So now the next point after this, we are going to speak about the C component. The C component is for the cardiac silhouette. Is the C component of the chest X-ray. Cardiac silhouette. When you want to describe the cardiac silhouette, you describe the shape of the cardiac silhouette and you describe the cardiothoracic index. Is it clear? Now for the shape of the cardiac silhouette, you have different shape of the heart of the cardiac silhouette. The different shape of the heart, you can have the first shape, which is boot shape. Boot shape is specific for a tetralogy of Fallot. When you have a tetralogy of Fallot, boot shape is specific for that. Now on the next one, we have also a calabash shape. Calabash shape. Is it clear? Calabash shape is when calabash shape is specific now for a pericardial effusion. When you have a pericardial effusion, you're going to have a calabash shape. So boot shape resemble your heart is going to be as such. Is it clear? It means that the apex is going to be lifted up. That's a boot-shaped heart. This is usually as a result of a right ventricular hypertrophy that occurs in the tetralogy of Fallot. It's one element in the tetralogy of Fallot. So it's going to push up the apex of the heart with a boot shape. Now, or we can also call le sabot. In French, it is called le signe de sabot. Is it clear? So French is called sabot, or so those are the different things. Now we have calabash shape. Calabash shape resemble as such like a calabash. The calabash that is being used in the desert to drink water. That's how the heart is going to resemble calabash shaped heart. Basically. Now we have dextro-rotated heart. Dextro-rotated. Is it clear? So dextro-rotated heart is another shape the heart can have. So normally the heart should be like this. Is it clear? But now if you see instead the heart like this on your chest X-ray, is it clear? In the normal view, you now see that this is a dextro-rotated heart, and this dextro-rotated heart occurs in dextrocardia. It occurs in dextrocardia, and dextrocardia is among a syndrome called the Cartagena syndrome. It's among a syndrome called the Cartagena syndrome, and the Cartagena syndrome is made up is a disorder. In this disorder, you have situs inversus. You have situs inversus in Cartagena syndrome, and you have also a problem with the ciliary system. It means that the ciliary system, the part that is the cilia is supposed to work, is not working again. So those rhythmic ciliary movement are not working again. So it is made up of two elements, situs inversus. The situs inversus is having situs inversus totalis. Meaning that all the part of the body is rotated toward the other side. It means that the appendix is going to be rotated to the other side, and we are in case where you have appendicitis, the patient is going to present with left iliac fossa pain. The heart is going to be rotated to the other side, so the apex of the heart is going to be located at the right mid-clavicular line, feet intercostal space. That's situs inversus totalis. So all the organs of the body is rotated to the other side. Situs inversus, that's one element of the Cartagena syndrome. Another element of the Cartagena syndrome is ciliary system abnormalities. Now the sinuses, which are the level of the nose or the nasal cavity, uses an other facial aspect of the head, uses the cilia in order to remove all dirt product or all waste product. So since the ciliary system is not working, you are going to have sinusitis. So if you have a patient that has regular sinusitis, it can make you think of that. The second one is also the lower respiratory tract. Usually removes the mucus that is excessive, or the waste mucus down from the lower respiratory tract into the upper respiratory tract where it can be coughed out. Is via the ciliary system. Now, since the ciliary system is not working, the lower respiratory tract is not capable of removing this mucus, so it's going to accumulate. When it accumulates, you have a chronic infection of the lower respiratory tract that results to a disease called a bronchiectasis. Is it clear? And bronchiectasis is also another element in Cartagena syndrome. The third one is in females. You need to know that the ciliary system is required to push the fertilized ovum from the fallopian tube into the uterus. That's why in females you can have a female infertility where it cannot be pushed again. So you can have female infertility. Now also in males you have what? In nose, you need to know that the ciliary system is important at the level of the seminiferous tubules and the vas deferens in order to push the sperm so that it can be used in the seminiferous tubules in the vas deferens in order to push the sperm that have been produced and for it to go at the level of the epididymis. Is it clear? For it to be stored there. Is it clear? Now, since the ciliary system also in males is not working, you can have also male infertility. That's just summarized as male and female infertility. That is just infertility. Is it clear? So you can have infertility in this patient. So those are the four major elements in Cartagena syndrome. You have situs inversus, that is one. Second element is sinusitis. The third element is bronchiectasis. The fourth element is infertility. Now, the next point after that, after knowing the shape of the heart, we have now the knowing the cardiothoracic index. Now, for the cardiothoracic index, you just have to take your chest X-ray. You measure the largest cardiac diameter. So you measure the largest cardiac diameter from here, from this point here to the apex. Just straight lines from the largest point here to the largest point here, which is the apex. So draw from here to here. Measure the largest cardiac diameter, and then you measure the thoracic diameter. To measure the thoracic diameter, you measure if you have the diaphragm associated. This is the costodiaphragmatic angle. Is it clear? This is another costodiaphragmatic angle. You measure from that costo the internal aspect of the costodiaphragmatic angle, not from the external aspect. You measure from the internal aspect of the costodiaphragmatic angle here and not from here. Please measure from the internal aspect from the costodiaphragmatic angle to the other internal aspect of the costodiaphragmatic angle. Is it clear? So the cardiothoracic index is going to be the cardiac diameter